My name is Dr. Arun Panda. I'm a facial cosmetic surgeon. I'm a practice Bodyskulpt Aesthetics is a state-of-art aesthetic center at Vashi, Navi Mumbai. So friends, let's talk about what is chin liposuction, where is it done, why is it done, and what's the cost involved in it. Okay, let us first try and understand why we do a liposuction here. Many of our patients, they come and complain about something called as a double chin. Double chin is a condition wherein when the patient starts folding or bending his chin area here, we see another fold of fat which is seen here, and this gives an appearance of another chin. So that's why it's called as a double chin. Why is it seen and why do we patients find this? So what happens is basically we have a muscle here called the platysma. Any fat which is deposited above that, between the skin and the platysma, that gives the appearance of this fat called the submental fat, or basically which gives a condition called as a double chin. So how do we treat it? Because it is anesthetically very unpleasing and it doesn't look really nice. A lot of patients complain about this and they come back to us and say, what can be done? There are certain non-surgical modalities and surgical modalities. So the non-surgical modalities include lipolytic injections. Some injections like deoxycholic acid which can be injected into this fat, which breaks this fat, and once the fat is broken, it is actually drained out through the lymphatics. But it is a very long procedure, multiple sittings are required, and we do not know how much of fat is going to melt and how much of a results we are going to kind of achieve at the end of the procedures. Although we get a decent amount of results, but it takes a long period of time. So what is a permanent better solution? So there is a procedure which is called as a liposuction, wherein we can suck out the fat which is just above the platysma, the muscle which is there just above that, we can suck it out. So this is called as a chin liposuction, basically to remove the double chin area. It's a simple procedure which can be done in our operation theatre under local anesthesia. We do not have to go in for general anesthesia. If a patient is really reluctant, we can take them under sedation if required, but most of our patients, they want to go under local anesthesia. So how is it performed? As I said, it is done in a very sterile environment. So the procedure goes like this. The first thing what we do is, inside the chin area, inside the fat, we put something called as a tumescent anesthesia. So this is a cannula which has got openings at the end. So through this we make a small opening here under the chin, a small opening even less than about 3 to 5 millimeters, and through that we push some tumescent solution. So tumescent solution is something which kind of breaks the fat there and also makes this area so taut. So once we have done that, this also helps us in anesthetizing the whole area. So basically we add, with Ringer's lactate solution, we add lignocaine and ropivacaine, which are highly potent anesthetic agents. So they go and numb the whole area and also break the fat there. So this is basically pushing the tumescent. So once we have done that, we wait for about 10 to 15 minutes, and then we have cannulas. So these are the cannulas which can be utilized. So they have ports. So this, once they put inside, we use a suction here. So we use either a suction machine or we use a negative pressure with a 50 ml syringe, and then we just go in and place it inside and we just start sucking out. So automatically what happens is, with the negative pressure, the fat from this area, it comes out. So the most important thing is, your surgeon should be very well experienced to stay above the platysma. So as I said, the fat is above the platysma. So we need to stay above the platysma, and we are totally safe if we are staying above the platysma. Although there are vital structures here, but if your surgeon is experienced and he has done many liposuctions, so he will be much more comfortable and he can do the liposuction easily without any complication. Now coming to the cost part of it, there is a lot of variation involved, how much it costs. So basically what happens, how much the patient, if he is comfortable under local or sedation or general anesthesia, or how good your surgeon is basically. In our practice at Bodyskulpt Aesthetics, for our patients, we charge anything between 50,000-60,000 to 70,000-80,000, but that's a one-time investment and you have got rid of your double chin there. How long is the recovery period is another question which the patient normally asks. So basically, once we have done the liposuction, we tell our patients to stay at home for at least 3 to 4 days. That's because there's going to be a lot of bruising, there's going to be a lot of swelling there. So 3 to 4 days is going to be our recovery phase, and we're going to be giving you a pressure bandage. So the pressure bandage has to be tied all around for at least 2 to 3 weeks. That keeps the skin from getting loose, and that tightens the skin as well. As I had mentioned you earlier in our earlier videos, that there are two components, there is the skin and your fat. So we also need to shrink your skin along with removal of the fat. So that's why the pressure bandage has to be taken care of, and the pressure bandage has to stay there for a while. So guys, if you're looking at taking care of your double chin, liposuction is a very safe procedure and very effective procedure, and it can take care of your double chin in one procedure, one step. And if you have more queries about any other facial cosmetic surgical procedure, please get in touch with us and we'll be more than happy to help you out.